Good afternoon, ma'am. My name is Maria Desiree Alaptihan from the SN2E Group 1, and today I'm going to perform a return demonstration on the administration of a vaginal cream. The goal of this procedure is that the medication is administered successfully into the vagina. So the first thing that we need to do is to gather the equipment to ensure that we save time. Next, I'll introduce the equipment. So we have here a hand towel, a substitute for basin, and this contains water. Next is we have cream, a 1 cc syringe as a substitute for the applicator. Then we have 2 pair of clean gloves, then a substitute for lubricant. Then we have here a drape and alcohol for the hand hygiene. Next is we have to check the medication order against the original order in the patient's chart to ensure accuracy, and we have to clarify any inconsistencies and check the patient's chart again for any allergies. Next is we have to know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medication to be administered to the patient. And we also need to consider the appropriateness of the medication to the patient to ensure the appropriate intervention given to the patient. Next is we have to perform hand hygiene to prevent the spread of microorganisms. So there. Next is we have to move the medication cart outside the patient's room or prepare for medication in the medication area so that we can prepare more comfortably. Then next is we have to unlock the patient's medication cart or drawer and enter passcode or scan employee identification if necessary. Then next is we must ensure that we provide medication for one patient at a time to prevent any errors with regards to administration of medication. Next is we have to proceed with reading the CMAR MAR and select the appropriate medication from the patient's unit stock or drawer. Then we have to compare the label with the CMAR or MAR to ensure that we get the right medication. Then we have to check the expiration date and we have to perform calculations if necessary. Then we have to also scan the barcode of the package in some cases according to facility policy. When all medications for one patient have been prepared, we must check or read again the CMAR or MAR to ensure that we are preparing the right medication for the right patient. So we need to do this, or we must check the label 3 times to minimize medication error before transporting it to the patient. Next is we must lock the patient's cart or drawer before leaving it to ensure that we are safeguarding the patient's medications. Next is we have to transport the medication to the patient's bedside carefully, and we must keep sight of the medication at all times. So we must ensure that the patient receives the medication at the right time, or 30 minutes before or 30 minutes after the designated time. Next is we have to perform another hand hygiene and wear PPE indicated to prevent the transmission of microorganisms. Next is we have to identify the patient to ensure that we are giving the right medication to the right patient. So we can do this by checking the ID band of the patient for his or her name and ID number. Then we can also ask the patient to state his or her name and birthday, or if the patient is unconscious, we can ask a staff who knows the patient for the second source. So next is we need to complete necessary assessment before administering the medication. So we must check the patient's allergy bracelet or ask the patient about any allergies, and we must explain the purpose and action of the medication that we are going to administer to the patient to prevent patient's anxiety. We'll scan the barcode on the patient's ID band if necessary. Then we have to put on gloves. After putting on the gloves, we must ask the patient to void before inserting the medication into the vagina to prevent pressure on the bladder. Then we must position the patient so that she is lying on her back with knees flexed. Knees flexed. So, considering that the patient is in the right position, we must maintain the privacy of the patient with draping. 2, of course, provide patient privacy and save the patient's dignity. Then we must ensure adequate lighting so that we have a clear visualization of the patient's vaginal opening. So next, we are going to spread now the labia of the patient using our fingers, and then cleanse the area above cleanse the area at the vaginal orifice using washcloth with warm water. So we are using number 7 stroke from the upper to downward motion, and then we must remember to use different corner of the washcloth for each stroke. So we're going to start here. So number 7, and then another one using this side, and then we're going to turn it using the clean side to clean the middle or the vaginal orifice from or moving above the perineal area down to the sacrum. So this motion prevents the contamination of the clean area with microorganisms. So after this, we're going to remove it, and we have to change our gloves with another clean gloves. So next, we are going to fill the applicator with the prescribed amount of the vaginal cream. Example, the doctor ordered 3.3 cc. So I have now obtained. So now I obtained the sample prescribed dose of vaginal cream. Now, I will lubricate. So this is an example. This is a substitute lubricant. So I will now lubricate the tip of the applicator about 3 centimeters. Then, after that, I will now spread the labia with my non-dominant hand and introduce applicator with
my non-dominant hand gently to the patient's vagina in a rolling manner while moving it downward and backwards.
After applicator is properly positioned, a labia may be allowed to fall into place to free the hand for moving the plunger. So, push the plunger to its full length and then remove the applicator with its plunger different. So, plunger out. So, after pulling the plunger out, we have to ask the patient to maintain the supine position for about 5 to 10 minutes in order for the patient's vagina to absorb the cream or the medication. And then we have to offer the patient perineal pad to absorb any discharge. Then after that, we have to dispose the applicator to its appropriate receptacle or clean, non-disposable applicator according to its manufacturer's policy. Then after that, we have to remove our gloves and PPE if worn, and then perform hand hygiene. And after that, we have to document the administration right after the administration to prevent any charting errors. Evaluate the patient's response with the medication within the appropriate time frame to ensure that the patient is receiving the appropriate therapeutic effect of the medication administered.